सर्वाइकल स्पॉन्डिलोसिस को दो पार्ट्स में डिवाइड किया जा सकता है, बांटा जा सकता है. Like there is one is a yes type of cervical spondylosis. Yes. Second is no type of cervical spondylosis. In the cervical spine, we can see the vertebra from C1 to C7. We know this is the C1 vertebra, then the C2 vertebra. In this way, we are having C1 to C7 vertebra. If we talk about the C1 vertebra, C1, this is a C1. It is making junction with the occiput. ये हमारे occiput के साथ मिलकर junction बनाता है. So this is called C0, C1. इसे हम कहते हैं C0, C1. The occiput and cervical vertebra number 1. Then C1 and C2 are making junction. फिर हमारे C1 और C2 मिलकर junction बनाते हैं cervical 1 and cervical 2. उन्हें हम कहते हैं C1, C2 junctions, right? फिर उसके बाद हमारी cervical 3, 4, 5, 6, 7. So C1, C2 we can categorize in the upper cervical vertebra, and C3 onwards we can understand them as a lower cervical vertebra. So we can divide the cervical vertebra in two parts: upper cervical vertebra and the lower cervical vertebra. Upper cervical vertebra means C1, C2, and the lower cervical vertebra means C3, 4, 5, 6, and 7. Right? Every vertebra having different movement. Suppose I want to do flexion extension or yes type movement. This is done by C0, C1. Okay. Then I want to do rotation. Rotation. It is done by then C1, C2. Okay. That is also called node type. So C1, C2. Then if I want to do again C3, 4, 5, 6, 7. The major movement of these all vertebrae is also flexion extension. Got it? So we can consider there are 5 type of movement. Number 1, flexion extension, C0, C1. Rotation, C1, C2. Then all the remaining vertebrae again reflection extension. They are the major movements. ये हम मेजर मूवमेंट बोलते हैं इनको. चलिए एक बार फिर से हम समझते हैं यहाँ पर. Let's see here. So occiput means we are considering as a C0, and this is cervical vertebra 1. So this is the occiput, and this is the cervical vertebra number 1, which is the name of this vertebra is atlas. इस vertebra को हम कहते हैं atlas. So this joint is called this joint. The name of this joint is atlanto-occipital joint or C0, C1. The movement is flexion and extension, or we can consider yes type movement. गर्दन को आगे ले जाना flexion, पीछे ले जाना extension. Then we are coming to the next vertebra. So this is the C1 and C2. So C1 and C2. द नेम ऑफ C1 इज एटलस, जस्ट वी हैव सीन, अभी अभी हमने देखा, इसका नाम है एटलस। और द नेम ऑफ C2 इज एक्सिस, ये इसका नाम है एक्सिस। सो दिस जॉइंट इज कॉल्ड एटलांटो एक्सियल जॉइंट। द मेजर मूवमेंट इज a rotation or no type of movement. Okay. So this is atlantoaxial joint. Why we are taking atlantoaxial joint? If you see here, अगर आप यहाँ पर देखें, so these are the two vertebrae. One is the upper one, atlanto, one is the lower one. The lower one is called axis. We can see here. If we remove the upper one, अगर हम upper one को हटा दें, how this is making axis? Why this elevated process around which the upper vertebra is moving, around which the upper vertebra is doing movement? So this is making axis. So it is called axis, axial, right? Axis. So this is the process. This is called dense. ये हम कहते हैं कि हमारे सर्वाइकल टू में एक ऊपर की उठा हुआ प्रोसेस पाया जाता है जिसे हम डेंस कहते हैं और इस वर्टिब्रा को बोलते हैं एक्सिस. So in this way, this is our second joint that is called C1 C2 or atlantoaxial joint. Right. Then we are coming down. अब हम नीचे आते हैं. Then there is a C3, C4, C5, C6, C7. These are called lower cervical vertebrae. And C1, C2 is coming in the upper cervical vertebra. When there is a problem in the upper cervical vertebra, the person will be suffering the problem in the head region. उसे सिर की प्रॉब्लम होंगी, जैसे कि any problem in the eyes or tinnitus, ringing sound in the ear, or there might be numbness on the face or flickering of the face or eyes, or migraine headache, occipital headache. Some problem in the head region. अगर C1 C2 में प्रॉब्लम होती है तो पेशेंट आपके पास आके या तो बोलेगा गर्दन में दर्द है. ऐसा कोई जरूरी नहीं कि गर्दन दर्द ही बोले. आप इंतजार करो कि ये गर्दन दर्द बोले तो मैं ट्रीटमेंट करूं. वो आपको गर्दन दर्द ना बोल के बोल सकता है कि मुझे आंखों में फड़कन हो रही है, चेहरे पे नमनेस आ रही है, सिर में दर्द हो रहा है. कुछ ना कुछ वो लक्षण बोलेगा जिसका संबंध हमारे सिर से है, क्योंकि हमारे C1 C2 से निकलने वाली नर्व हमारे सिर को सब जाती है. और लोअर सर्वाइकल वर्टिब्रास आर क्रिएटिंग इश्यूज, द नेक पेन, lower neck pain, shoulder pain, or the upper back pain. Even the upper back pain might be because of the lower cervical vertebra, then pain and numbness in the arm, some tingling sensation in the fingers, maybe trigger finger, maybe tennis elbow, maybe carpal tunnel syndrome, some problem in the arm or shoulder pain. This is because of the lower cervical vertebra, right? Lower cervical vertebra is very much important. Even the person is suffering with the lower cervical vertebra, what other thing will happen? From the C2, अगर हम cervical 2 की बात करें, From the C2 vertebra. C2 vertebra is very much important. From the C2 vertebra, there is one nerve is crossing. The name of that nerve is vagus nerve. Vagus nerve is the very important nerve who is relaxing our entire system. वेगस नर्व हमारे शरीर की एक बहुत ही महत्वपूर्ण नर्व है, हमारे पूरे सिस्टम को रिलैक्स करती है वेगस नर्व, विच इज गोइंग थ्रू द C2 सर्वाइकल वर्टिब्रा, हमारे C2 से जाती है. यू लुक एट द बॉडी, अगर आप बॉडी को देखें, someone is suffering with the problem of the lungs, someone is suffering with the problem of the heart or any body parts. We know हम जब खाना खाते हैं तो खाना पचता है. क्यों पचता है खाना? जब हमारा वेगस नर्व एक्टिवेट होता है. Vagus nerve is connected with the digestion. So any problem in the cervical vertebrae, in the upper cervical vertebrae, we can see patient is suffering with the digestive problems because C2 vertebra is having connection with vagus nerve. Even working on the C2 will work on your digestion. The vagus nerve is relaxing your heart. If heart is beating high, if the person is suffering with a high blood pressure, C2 vertebra is connected. Then C2 vertebra connected with the high blood pressure because of the connection of the vagus nerve. आप जब रिलैक्स होते हैं तो आपकी वेगस नर्व एक्टिवेटेड है. जब आप हरी करी बरी में होते हैं तो आपका सिंपैथेटिक सिस्टम एक्टिवेट है. वेगस नर्व इज द पार्ट ऑफ पैरासिम्पैथेटिक नर्वस सिस्टम. सो C2 vertebra is very deeply connected with vagus nerve. In this way, cervical, if the person is having some problem which is connected with the heart or the indigestion, you might have to do the treatment of vagus nerve. Then we are coming to the lower cervical. हम lower cervical की बात करते हैं, especially we talk about the C3, C4 and C5. अब हम C3, C4, C5 की बात करते हैं. C3 vertebra, C4 vertebra and the C5 vertebra. Very important vertebra, because from here one very important nerve is going, that is phrenic nerve, जिसे हम phrenic nerve कहते हैं. phrenic nerve C3, C4, C5 से निकलती है और लिवर को सप्लाई करती है. So now we can see in this image here. The nerve going out from the cervical vertebrae C3, C4, C5 and supplying your liver, even the diaphragm. So phrenic nerve who is going out from C3, C4, C5, supplying the diaphragm and the liver. Now you can understand, if the person is having any problem in the neck, will serve, it might be due to the liver. That's why in the TCM it's mentioned, if the person is having liver problem, will be suffering with the neck pain. अगर TCM में ये बात क्लियरली मेंशन की गई है कि अगर किसी व्यक्ति को लिवर की प्रॉब्लम से गर्दन का दर्द होगा, बार बार होगा, फ्रिक्वेंटली होगा, लेकिन वहां ये फ्रेनिक नर्व की बात नहीं लिखी है जो अभी हम समझ सकते हैं. तो डायफ्राम इज द चीफ रेस्पिरेटरी मसल. डायफ्राम हमारे चीफ रेस्पिरेटरी मसल है, हम जानते हैं, हम श्वास लेते और छोड़ते हैं. डायफ्राम इज द चीफ रेस्पिरेटरी मसल्स. If the diaphragm is having some problem, we will be suffering with the digestive problems. So now, if the problem in the C3, C4, C5, there will be problem in the diaphragm, then breathing problem. So now you can understand, cervical vertebrae also can create breathing discomfort, breathing problem, diaphragm problem. Two connection. Number one, liver. Number two, diaphragm. Let's see how can we work on this. हम आखिरकार इस पर कैसे काम कर सकते हैं. हालांकि और भी कनेक्शंस हैं। पहले हम समझते हैं कि हम कैसे वर्क कर सकते हैं, हाउ कैन वी वर्क ऑन दिस। So first, I would want to tell you, if the person is suffering with the pain, too much pain, generally we are sedating all the points. हम सारे point को sedate करते हैं, right? So first, I will tell you how to work generally. Then we will also discuss how to work for the patient suffering with the high blood pressure and the low blood pressure. Because if the person is having high blood pressure or the low blood pressure, we have to change the formula little. हमें थोड़े से formula बदलना होगा. So number one, we are discussing the yes type of cervical spondylosis. Yes type. In the TCM, it is called Tai Yang type. Tai Yang type. Because Tai Yang means small intestine and the urinary bladder. SI और U भी हमारे exactly back part को supply करता है. So number one, we are starting the treatment SI3 and the urinary bladder 62. First, I will tell you set it all the points. हम सारे पॉइंट को set it करेंगे. हाई बीपी लो बीपी वाले के लिए थोड़ा प्रोटोकॉल बदलेगा. We'll see shortly. SI3 UV62 sedation, we are doing bilateral all the points. Even SI3 UV62 we are doing bilateral. हम पूरे का पूरा bilateral कर रहे हैं. There are two conditions. Either we can do on the same side. If the person is telling, can you treat me? I'm suffering with the pain when I do yash movement. पेशेंट ने कहा कि मुझे गर्दन में दर्द होता है जब मैं आगे पीछे करता हूं. If the person is telling more pain on the right side, we can go on the right side only, or we can go bilateral. Then we are taking some local point. We know governing vessel 14 is the local point of the neck. हम जानते हैं कि governing vessel 14 हमारे गर्दन का local point है. Then we are taking governing vessel 20. UV10 11 is the local point of the neck. UV60 will be the distal point. UV6 on the top of the head, which is very effective skull point. Lung 7 is the distal point of neck, and the SI4 is a single point. Even this alone can remove the neck pain. SI4 एक ऐसा point है कि अकेला ही पूरे neck को ठीक कर सकता है, because it is a source point. So let's see here few points quickly. So first, I would like to highlight the point on bladder channel. So let's see here. So this is the bladder 10. If the person is suffering with a neck pain, we can use this bladder 10. Bladder 10 is on the hairline 1.3 chun right and 1.3 chun left. ये हमारी hairline से 1.3 chun right और 1.3 chun left होता है. Got it? So this is the bladder 10. The second point we discussed bladder 11. हमने अगले point की बात की. ये हमारा bladder 11 urinary bladder 11. Exactly in the center we can see. So this is the thoracic vertebra 1. It is just below the thoracic vertebra. If from this point if we go right and left, that is a urinary bladder 1. Urinary bladder 1 is the local point of the neck, as well as it is the influential point of all bones. ये हमारी सारी बोन का influential point है. So below the 11. Now from here, this is the below the thoracic one. If you go above the thoracic one, अगर हम thoracic one के ऊपर जाएं, the center point is governing vessel 14. The governing vessel 14 located between C7 and T1. हम जानते हैं हमारा governing vessel 14 C7 और T1 के बीच में होता है. So we can see here governing vessel 14. This is the point below the C7, C7 के नीचे है. It's a very important point. And the local point for the neck pain. In the governing vessel, we already have taken the point on the top of the head, DU20. It is also very effective point for neck pain. तो हमने इस तरह के कुछ पॉइंट लिए. Two more point I would like to highlight. One is the UV60. UV60 we always take for neck pain. ये हमेशा हम लेते हैं. ये हमारी गर्दन दर्द के लिए. Urinary bladder 60. ये हमारे मेल्यूलस के बाहर होता है, right? So this point is located on the lateral side of malleolus. We can see here. Okay, right now video is not available. You can see the image. Fine. So now we can see here UV60. हमारा जो urinary bladder 60 है, ये गर्दन दर्द का बहुत ही यूनिक पॉइंट है UV60. So whenever the person is suffering with the neck pain, we always think for this point. You can see in this image. आप यहाँ देख सकते हैं. If you look at my leg here, so this is the lateral malleolus. Sorry, on the back side here, that is the urinary bladder 60. So it is a single point. Why it is a single point? As per the imagination concept. अगर हम अपने पैर को बॉडी माने तो गर्दन हमारी एंकल जॉइंट पर आएगी. So we can do the imagination in that way. Suppose consider the legs. पैरों को अगर आप संपूर्ण शरीर माने, suppose this is the body. So now if you consider the head region, so the area of the ankle become neck region. Then this is the chest, navel means knee, and thigh will be the abdomen. So urinary bladder 60 located around the ankle joint will be very good for neck pain. And this is called distal point for neck. ये हमारे neck का distal point कहलाता है. UV60. UV60 is very, very effective. And regarding the SI4, I would like to tell you, we have seen in the some other discussion, the small intestine, this is the SI4. The source point of any meridian having this power to relieve the pain from entire meridian. सोर्स पॉइंट के पास वो ताकत होती है कि वो पूरे मेरिडियन के दर्द को निकाल सकता है. SI4 is the source point. So if we can see this depression. You can try if someone is suffering with a neck pain, just to treat one point SI4. आप एक ही पॉइंट लगा दो बस, बाकी कुछ मत लगाओ. SI4. In many cases, in many patients, you will see pain relieved just by SI4. SI4 is the source point for SI meridian. SI meridian going on the back side and crossing over head region. So SI4 is a single point for this purpose. Okay. So ultimately, there are many points here. Around the DU20, we have UB6. हमारे DU20 के पास UB6 है. Okay. That is also a very good point for neck pain. Ultimately, this protocol is called the protocol for, yeah, that will work if the pain in the SI meridian. Yes, right. SI meridian will work on the if the pain in the SI meridian, but SI meridian also will work if the pain in the urinary bladder meridian. So there are many different pain. I will tell you. Just I told you, many person are can suffer with the neck pain. कई लोगों को गर्दन का दर्द हो सकता है. कब कब हो सकता है? If they are having liver problem. अगर किसी को liver की problem है, liver issue. If the person is suffering with the liver issue, might have neck pain. Just I told you. तो अब आप सोचिए कि क्या SI4 लिवर के कारण होने वाले गर्दन दर्द को ठीक कर सकता है या नहीं. Whether SI4 can work on the neck pain due to the liver? Answer is yes. Why? 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 अगर किसी को गर्दन में दर्द है, maybe there is a liver problem and phrenic nerve is coming and creating the neck pain. It is because of the liver. Can we work with SI4? Answer is yes. Why? Because in the organ clock cycle, we know the timing of SI and liver just opposite. The timing of liver 1 to 3 in the night, the timing of small intestine 1 to 3 in the day, both are connected with the organ clock opposite cycle. If you do anything on the liver, it will affect the SI. If you do anything on the SI, it will affect the liver. So that's why SI4 is a very good point for the neck pain. Number two, SI meridian itself is going from neck. If the problem in the SI meridian, it will work on the neck pain. Number three, SI and can work on the pain if it is happening on the UV channel, because SI and UV are the part of Taiyang. In this way, SI having many effective connections. Getting my point? Clear? This concept is clear or not? Okay. So let's move to the next pain, that is no type. अब हम no type की बात करते हैं. In the TCM, it is called Shaoyang type pain. Shaoyang type cervical spondylitis. इसे हम कहते हैं Shaoyang. Shaoyang means triple Borman and gallbladder who supply lateral side or the side of the body. So this pain is called Shaoyang type. So when we are moving the neck right and left, we are having pain. जब हम गर्दन को right left घुमाते हैं और दर्द होता है. Few point will remain same, but few point will be very specific point here. We'll start our treatment with a triple warm of 5 and the gallbladder 41. I will tell you again, said it all the point. And we are using all the point bilaterally here. हम सारे point को bilaterally use कर रहे हैं. So triple warm of 5 and the gallbladder 41. We'll start the treatment from here. We are taking many local points like gallbladder 20, gallbladder 21, gallbladder 34, and 39 are the distal point. We are taking some distal point and local point at a very effective protocol. Quickly you will see the results. आपको result एकदम से दिखेगा. You put the point in 10 minutes, you will see excellent results because we are working in a whole. Whether the problem coming because of the liver, चाहे liver capsule से problem आ रही है, whether the problem coming from the diaphragm, whether the problem coming from some inner area, we will able to work using this protocol. Right. So now the main point will be triple warm of 5 and the gallbladder 41. Even I will tell you, for many patients, I had tried only these 2 points, triple warm of 5 and the gallbladder 41, and seen good results. केवल EOB का यही तो concept है. EOB में 2 point भी वो कर सकते हैं जो बहुत सारे points मिलके ना कर सके. So because of this concept, EOB points are very much effective. So let's see. We already have discussed the location of triple bomb of 5 and gallbladder 41. So we are not discussing that location again, but I will tell you other points. most effective points and the very effective points. The gallbladder 20 is a very effective point for this product. Gallbladder 20. Gallbladder 20 on the sides, you can feel the depression here. आप यहाँ पर side में feel कर सकते. So this is the sternocleidomastoid muscle. On the back side of the sternocleidomastoid muscle, we can see this point. This is the gallbladder 20. Now, gallbladder 21 on the shoulder, हमारा gallbladder 21 shoulder में है. We can see this is located on the shoulder area. Gallbladder. इनको measure करने के कुछ तरीके हैं, but right now I'm just discussing the protocol. But you should know exact location of the point also. This is the gallbladder 21, right? On the trapezius muscle on the shoulder. Right. ये अगर देखा जाए, so from the midpoint of the neck and the shoulder exactly in the center, this point is located. Means I'm telling about the distance. Halfway, neck to shoulder. अगर आप गर्दन से शोल्डर तक की जर्नी करते हैं तो हाफ वे में आपको गॉलब्लैडर 21 मिलता है. कहाँ मिलता है? ऑन द ट्रापेजियस मसल. आपकी यहाँ half वे में, starting the journey from the neck to the shoulder, in the half वे you will find this point. This is gallbladder 21. Then the two very effective point, without that protocol is always incomplete. दो बहुत ही effective point. इसके बिना आपका प्रोटोकॉल अधूरा है. और ये दो पॉइंट लगाने मात्र से भी आपका पेशेंट ठीक हो सकता है. वन इज द गॉलब्लैडर 34 in the leg and one is the gallbladder 39. These 2 points, gallbladder 39 and 34. 39 is 3 inches above from the ankle joint. इन दो पॉइंट्स के बिना आपका ट्रीटमेंट अधूरा है. इसके बिना तो ट्रीटमेंट करने की सोचना भी मत. पेशेंट का रिजल्ट्स इतना अच्छा नहीं होगा. So now we can see some point we have taken as a local point again, like we have seen gallbladder 14 as a local point, right? Now lung 7 is the distal point of neck, and we have taken LI4 as a analgesic point or the painkiller point here. LI4. Very effective protocol. Studied all the points, try these points. So today we have discussed yes type and no type. In the tomorrow class, we will discuss for the patient suffering with a low BP, how to make the plan by just using 3 to 4 points. It will be different for male and female. And the patient suffering with a high blood pressure, how to make the plan for cervical spondylosis. So this the discussion will be tomorrow. Let's close the session. Thank you so much. Closing the session now.